Herpes zoster, a debilitating disease in older adults caused by varicella zoster virus, or VZV, affects approximately 1 million individuals per year in the United States. The incidence and severity of herpes zoster and its major complication, post-herpetic neuralgia, increase with advancing age, creating a significant public health burden in aging populations. Primary VZV infection begins with the virus entering the body through the respiratory tract. Upon penetration of a regional lymph node, VZV infects macrophages where the virus replicates. Infected macrophages travel through the blood, delivering the virus to the skin. Infection of skin cells results in the development of chickenpox and also induces a cellular immune response mediated by lymphocytes, which allows chickenpox to resolve. VZV-specific cell-mediated immunity is long-lasting, but the virus is not cleared from the body. Instead, VZV enters nerve endings and travels up the nerve to the dorsal root ganglion, where the virus becomes latent. It is thought that T-cell surveillance of the dorsal root ganglion maintains latent VZV infection until VZV-specific cell-mediated immunity declines, such as with advancing age. VZV then becomes reactivated and travels down the sensory nerve to infect the skin. Inflammation at this site results in the development of the characteristic unilateral dermatomal herpes zoster rash and debilitating neuropathic pain. The rash typically heals within 1 month. However, the pain continues in the 10 to 20% of patients who develop post-herpetic neuralgia, or PHN, a disorder characterized by debilitating pain which persists for months after rash healing. PHN adversely impacts quality of life to a significant degree in older adults. Treatment of herpes zoster with antiviral therapy does not effectively reduce the risk of PHN, and current pain treatments for PHN also have limitations. Hence, a preventative herpes zoster vaccine is a promising strategy. A live attenuated herpes zoster vaccine has been developed. The vaccine is injected intramuscularly, and the attenuated virus is phagocytized by macrophages. VZV antigens are processed within the macrophage and then displayed on its surface for presentation to VZV-specific T cells in the spleen. Macrophage T cell interactions result in T cell activation and proliferation. Activated T cells patrol the dorsal root ganglion for VZV reactivation, thus preventing VZV reactivation and the subsequent development of herpes zoster. The zoster vaccine effectively reduces the incidence and severity of acute herpes zoster and also reduces the incidence of PHN. Thus, the vaccine offers the promise of preserving quality of life in populations at risk.